2 TB cases in 2 weeks, and right now 90 people here in the Bay Area are looking into whether or not they contracted tuberculosis from a USF student last week. Tampa police found 53-year-old Sarah Williams outside of an IHOP after she left the hospital against doctor's orders while she was infected. So what do you need to know if you've come in contact with these 2 patients or other people that may have been exposed from their infection? It's a very serious disease, and joining us now in the studio is Dr. Dragos Zanchi. He is the medical director of the Florida Institute Tampa Lung Institute, Florida Hospital Tampa Lung Institute. That's a long title. First of all, what do you do if you get in contact with this? It's airborne, so really if we're shopping, anywhere we are, we can feel it.
It's airborne. It's very easy transmissible disease. Any crowded place like a grocery store, like the mall, visiting the hospital, so it's really easy to get it. We have patients that actually are elderly, they have cancer, they are on immunosuppression, they are so susceptible to the disorders. Healthcare personnel, school teachers, policemen, inmates, and the personnel in jails are very high risk. We have to think about it.
If they do get exposed, I'm going to stop you right there. If they do get exposed, what should they do? Or if they think they're feeling kind of different, kind of weird, what should they go to?
Symptoms are important: cough, fever, maybe coughing with blood. They should address their doctor. The tests are very simple. We get a sputum culture, we get a skin test, and a chest X-ray. And when we have the diagnosis, it's very easy to treat it.
And you mentioned immune suppressed systems, people who might not have a very strong immunity, maybe some of the elderly, maybe people who are already dealing with diseases. They are especially at risk for tuberculosis.
Absolutely, you know what, and that's the problem. And we are facing a big problem with resistance of the bacteria to antibiotics. So it's a world problem, and it's happening here as well. So the faster we diagnose, the faster we treat, the better the patients are going to do.
Okay, kind of scary to think of it here in Tampa Bay, but you know, as you mentioned, it's a world problem, and it's hitting right here.
It's everywhere. It's Florida, and we have a lot of elderly patients around us that we have to be careful, and we have to care for them. So,
all right. Very
Thank you.
good. All right,
Thank
from
you.
Florida Hospital today, Dr. Dragos Zanchi, thank you so much for joining us here in studio. We appreciate it.
Thank you.